Community-based approaches to MHPSS programs. A guidance note was produced by the Interagency Standing Committee Reference Group on Mental Health and Psychosocial Support in Emergency Settings. The IASC Reference Group on MHPSS was established to support and advocate for the implementation of the IASC's landmark MHPSS guidelines, developed in 2007. The reference group consists of more than 50 members and fosters a unique collaboration between NGOs, UN, and international agencies and academics to promote best practices in MHPSS. The guidance described in this video was published by the reference group in 2019. Community-based approaches recognize that communities should be meaningfully involved in all stages of MHPSS responses. They view crisis-affected people as active participants in improving individual and collective well-being, rather than as passive recipients of services that are designed for them by others. These approaches facilitate communities to support and care for others, encourage recovery and resilience, and also contribute to the restoring and strengthening of essential collective structures and systems. Within community-based approaches, it is important what services are delivered and how people are involved in the process of working towards improved well-being. The guidance note describes community-based approaches to MHPSS as a process that consists of 4 phases. 1. Assessment. 2. Planning. 3. Startup and implementation. And 4. Evaluation. The first phase is assessment. Community-based MHPSS approaches use participatory, gender and age-appropriate, contextually relevant approaches to ensure that all stakeholders are engaged and represented throughout the process. During this phase, stakeholders identify risks, resources and strengths, for example, existing support mechanisms or gaps in community action. Analyzing and understanding the factors that impact on individual and collective well-being, identifying those that help strengthen the positive effects and mitigate the negative effects are at the center of community-based approaches to MHPSS. During the assessment phase, it is important that findings and results are shared wherever possible, in the local language and in culturally appropriate ways. The second phase is planning. Here, communities are engaged to prioritize problems and needs and find feasible ways to address them. Also, community stakeholders are involved in identifying and deciding what the indicators of success would be for the MHPSS program or activities. It is important that the planning phase finds ways to integrate services into wider systems to avoid fragmentation and support sustainability. The third phase is startup and implementation. In this phase, community members are engaged to identify the activities they can support and to mobilize resources to implement these. It is important that relevant community members are involved in all discussions, decisions, and actions, and that all stakeholders have access to information about the work being done. Special efforts are often needed to promote the inclusion of people who usually are marginalized, and this should be done sensitively. Regular monitoring of the implementation processes and safe, compliant mechanisms are vital to ensure that it stays on track and that problems are addressed in a timely manner. The last phase is evaluation. Community-based MHPSS approaches work with the community to identify what worked and what didn't, and evaluate if activities had their intended effect. Findings are shared and discussed with community members, and based on this process, there may be a readjustment of goals and activities. Implementing community-based MHPSS approaches may lead to ethical dilemmas and practical difficulties that are common within activities that engage communities, especially in difficult circumstances. Inclusive participatory processes can take time to carry out, whilst there are often urgent needs and issues to be addressed. It may be challenging to find a balance between conducting a comprehensive assessment and responding rapidly to immediate needs. Learning about existing community power dynamics can be helpful in avoiding actions that may compound existing inequalities or further exclude marginalized groups or individuals. The principle of do no harm must also be observed in navigating how the community-based process deals with possible conflicts and differences that may exist within or between groups, especially after violence. Whilst community-based approaches respect traditional cultural values and identities, they also must acknowledge that these are sometimes implicated in inequality, violence, and suffering within communities. Processes that seek to address mental health and psychosocial well-being must take this into account in terms of their design and implementation. Community-based MHPSS approaches put individuals, communities, and social systems at the center of the intervention in all phases of the response. The guidance note from the IASC reference group on MHPSS provides further detail on the processes that this entails. To access the publication, please visit the link given bit.ly/IASC-CB-MHPSS.